For those suffering from hair loss or hair thinning, there's medicines you can take, topicals you can apply, but a lot of people are looking for something more natural, something like PRP. I'm here at the PRP Center with board-certified PA Maggie McLaughlin. What is PRP?
PRP is platelet-rich plasma. It's essentially taking the best parts of your blood and using it to help with healing and strengthening in other parts of the body.
So how is this used with hair thinning or hair loss?
Essentially, we draw your blood, we concentrate it down. We're going to use the best parts of that plasma to then re-inject into the scalp, and that's going to be kind of like a fertilizer to the hair. It's going to help strengthen the hair follicle, so it's going to help with growth in the follicle.
So is this a permanent change that's going to happen like this?
Just kind of like fertilizer for your lawn, it does have some maintenance required for it. Based on clinical studies, the best way to start is doing it once a month for at least 3 months, and then you can move to the maintenance phase.
Who's a good candidate for something like this?
Anyone that actually has age-related hair loss and active hair follicles is a good candidate.
Men and women?
Mm-hmm, absolutely.
Okay, so I'm gonna get personal here.
Yeah.
Say like you have around your temples where it seems to thin out as we get older.
Yeah.
Would this be suitable for something like that?
Absolutely. That's actually one of the #1 spots, especially for women and men, actually, is the temples and the crown. And that is the main areas that we typically go for with the PRP treatment.
So take us through the process. We come to you for that initial consultation, and then where do we go from there?
So you'll come in for your consult. I, #1, want to make sure you're a good candidate before we do any type of procedure on you. If you are a good candidate, then we use really high quality equipment. We draw a healthy amount of blood to make sure that we get enough concentration of those platelets that we want. We put it in a centrifuge, we spin it down, and then I personally pull each PRP to make sure that we get that concentration that we want. We then have the patient come to the treatment room, we clean the scalp thoroughly, and then I go ahead and inject the scalp in a very specific way to make sure that we hit everywhere we want to hit and we don't miss any areas.
Well, and you were talking about that you're very specific in that dosage. How important is that?
Very important. So based on just studies that have looked at PRP for joints and hair, you want to make sure you have the right concentration of those platelets for it to be most effective. So that's why we're very specific on how we do it and then how I specifically pull it from each sample. And Dr. Kanan has been doing this for over 10 years, and so I think we have a very good and set process for how we do it.
It's not only hair that you're using this PRP for, it's the skin as well. We've seen that kind of vampire facial treatment, but this is a little different.
Yeah, so we kind of call it like the mini vampire facial. It's not as invasive as the ones you may have seen on TV or like celebrities talk about. But yeah, so the way the PRP works with the skin, especially when we use that microneedle, it causes like a little bit of trauma to the skin, which then lets us inject the PRP in, so it helps with collagen production, decrease fine lines, and overall good texture of the skin. So, you know, the side effect profile is essentially close to 0 for actual PRP because we're using you. We're using the best parts of you to kind of highlight and strengthen, grow the other areas that we want to, whether it be the hair or working on the face.
All of this sounds amazing. If you have any questions or you're interested in scheduling an appointment, you can do it right online, prpcenters.com.